The death of George Floyd and other Black people at the hands of police have caused stress, anxiety, and fear, especially among people of color. And recent data reveals suicides among Black people have been on the rise over the past year. To discuss the mental health impact on Black Americans, I want to bring in Michael Lindsey. He is the executive director of the McSilver Institute for Poverty, Policy, and Research at New York University. Thank you very much, Michael, for being with us. First of all, your reaction to the guilty verdict in Derek Chauvin's murder trial.
First of all, thank you for having me. Well, I watched it with my mom this afternoon, who is visiting me from Washington, D.C., my 81-year-old mother. We were very emotional. I remembered how my mom cautioned me how to conduct myself if I should happen to be pulled over by the police. George Floyd died at the hands of law enforcement, something that all people of color fear might happen to them. So I was incredibly emotional, but feeling a sense of vindication that justice had been served.
Well, how might this case, the Derek Chauvin case, and other cases of police brutality be impacting the mental health of Black Americans?
First of all, we have to acknowledge that it does impact Black Americans. A recent study by Jacob Bohr and colleagues published in the journal Lancet actually documented that if you live in proximity of a police shooting of a Black person, you're likely to experience psychological distress related to it. This wasn't the case for whites. It was only the case for Blacks. And so there is this sort of sense that you might have this sort of interaction with law enforcement. There's vicarious or secondary trauma in terms of having trouble sleeping or eating. There's this constant fear of law enforcement thinking that something sinister or harmful might happen to you. And so police brutality does indeed impact Black Americans.
You know, Michael, I wonder about children who have watched this. You know, I think about the little girl that testified in the Chauvin trial. You know, I wonder what the impact is specifically on Black children as they are seeing these images as well and watching the reaction of those adults around them.
You know, that's a really, really great point. And so my heart went out to the young lady as she recounted that horrible and horrific situation that she witnessed. You know, acts of discrimination are related to anxiety and can lead to trauma and a sense of hopelessness for kids. And so what we actually viewed, the world viewed indeed, in terms of what happened to George Floyd, was an act of racism or discrimination that impacts Black children. The constant experience of discrimination can lead to academic struggles and indeed has health consequences over the long term. And so studies have long held that racism is associated with many of the preventable diseases so often experienced by Black Americans, whether you're talking about hypertension, heart disease, it's all related. And so over the long course for kids, you know, those experiences weigh on them in terms of their both behavioral health as well as their physical health and has long-term consequences. And so I do worry about kids and what they're seeing and how they're taking in those experiences because it weighs on them heavily and has all kinds of impact on their well-being.
Well, we know that data collected from 9 of the nation's largest metropolitan communities shows that suicides among Black Americans increased approximately 17% from 2019 to 2020, and that rate is increasing faster than any other racial group. Why might that be?
Well, you know, there are no definitive conclusions because we really need more research, but there could be some plausible reasons for why we are seeing these increases. So the lack of access to mental health treatment, either because services are not always available in proximity to where you live, or in other instances, there's been stigma in the Black community related to experiencing a mental illness, but certainly related to mental health treatment. There's the fear that if you go to treatment, you won't see someone that looks like you, or you won't talk to someone who understands your unique experiences. And so there's been a divide between having a need for treatment and actually receiving mental health treatment. For youth, there's been disproportionate suspensions and expulsions from school. And so behavior is penalized instead of being treated. And certainly racial trauma plays a role, I think, in terms of why we're seeing these increasing rates.
Well, you were involved with creating the Pursuing Equity in Mental Health Act, which was reintroduced in the House this year. What changes do you believe are necessary right now to tackle the mental health crisis in the Black community? And I also wonder, Michael, in the near term, what is it that Black people can do to address these issues of, as you put it, a vicarious trauma from seeing these images and with children as well? What are some concrete steps people can take to mitigate the effects of this violence that is played out on television screens day in and day out?
Yes. So first of all, I'm thankful to Congresswoman Bonnie Watson-Coleman and members of the emergency task force that was convened by the Congressional Black Caucus, who took up this issue of Black youth suicide, the rising rates of suicide among Black youth, which we need to be paying greater attention to. So I'm really thankful to the Congresswoman and members of the Congressional Black Caucus for taking up this issue. For far too long, we've been talking about the disconnection from treatment for Black youth, the need for more supports in schools for kids. And it really was the work of Congresswoman Watson-Coleman and the Congressional Black Caucus that really shined a light on the issue to bring it to this sort of legislative state that we find this bill in. And so what we can do about this issue is we need to check in with kids about how they're experiencing all of these witnessing of police brutality. We need to understand how they're feeling and taking in this information or what they're seeing. We need to talk to them and not allow the media or social media to be the only definitive source for how they are interpreting what's happening. We need to connect kids to mental health supports and services when they are crying out for help. If you notice that your child or someone that you love is experiencing a functional change in terms of like they're not eating or their grades may dip if they're in school, those are warning signs that your loved one needs the support, perhaps a professional, to reconcile those issues. And so we just need to be checking in with our loved ones, particularly youth, about how they're experiencing all these things that are happening in our world, and really check in about their emotional state. I think, one of the things that we can do from a legislative perspective and training of law enforcement is to, focus on implicit biases around how one might view Black and brown people in terms of the conclusions that you draw when you first interact with them. I think that's really, really key to definitive change, I think, in terms of law enforcement. And hopefully we can see a decrease in the kinds of brutality that has been happening, particularly among Black and brown communities.
Yeah, the pattern that we have continued to see is such a voluminous evidentiary record of these interactions. And so these questions of why need to really be asked and probed. Michael, Lindsey, Michael, thank you very much. Some really important information about how to care for mental health, especially when we're talking about children. We really appreciate it, Michael. Thanks.
Thank you for having me.
And if you or someone you know is thinking about suicide or would like emotional support, the Lifeline Network is available 24 hours a day, 7 days a week. Call 1-800-273-8255 to speak with someone. That's 800-273-TALK, or you can go to suicidepreventionlifeline.org.